Welcome to another deep dive with My Mind MashUps. Today, we're pulling back the curtain a bit on pregnancy and that really intense first year of parenthood. You know the story everyone tells, right? Glowing mom-to-be, the perfect little baby, all that joy. And look, those moments are real, definitely, but there's also this whole other side, the intensity, the stuff you don't expect, the massive changes that often, just don't get talked about. So our mission today is to give you, our listener, some of these unspoken truths, what really happens physically, emotionally, socially during this huge time. We're using solid research-based sources here, medical groups, published studies, health agencies, trying to give you a clear, reliable picture. So yeah, settle in. And as we get into it, please remember to like, share, and subscribe or follow My Mind MashUps wherever you get your podcasts. You don't want to miss these deep dives.
That's exactly right. This isn't just, opinion. It's a deep dive based on evidence, practical advice, really aimed at first-time moms. We're hitting the themes that parents often say, I wish someone had told me that, so you know what might be coming and maybe how to handle it.
Okay, let's jump into a big one right away. Mental and emotional health. People hear baby blues, but for a lot of women, it's much, much more than that. We're talking about perinatal mood and anxiety disorders, PMADs. Can you kind of break down what that actually means?
Absolutely. PMADs aren't just one thing. There are a whole range of conditions that can pop up during pregnancy or even up to a year after the baby arrives. It's way beyond just feeling a bit down. It covers postpartum depression, anxiety, OCD, and sometimes, though it's rare, postpartum psychosis. And what's really striking, honestly, is how common it is. The Children's Hospital of Philadelphia estimates something like 1 in 7 women experience a PMAD.
Wow, 1 in 7. That's a huge number, yet it still feels like something people whisper about, if they talk about it at all. Why is it so often missed?
Well, partly it's the pressure, right? Everyone expects new moms to be constantly happy. But the signs it's more serious are things that really mess with your daily life, like persistent sadness that doesn't lift, big changes in eating habits, or sleep problems that stick around even when you do get a chance to sleep. And there are risk factors, big hormonal shifts, sure, but also a history of mood issues, maybe a previous loss, or big stressors like a baby needing NICU care. And the really crucial thing, if it's not addressed, it can seriously affect bonding with the baby and maybe even lead to things like colic or longer-term emotional issues for the child down the road.
Okay, so if someone listening recognizes those feelings, what are the absolute first things they should do?
Number 1, be proactive. Ask your doctor or midwife for screening, prenatal visits, postpartum checks, ask them to check in on your mood. Also, build your support system. Talk to your partner, friends, family, maybe find a support group. And remember, partners can struggle too. About 10% of dads get depression. So looking out for each other is key. If those feelings of sadness or maybe irritability or scary thoughts last more than, say, 2 weeks, definitely reach out to a professional. There's help available. Talk therapy, medications approved specifically for this. It really can make a massive difference. It's okay to need help.
Yeah, absolutely. Building on that emotional side, let's talk about something that can be really jarring for new moms, mom rage. It's this sudden, intense anger that can feel like it comes out of nowhere, often fueled by just sheer exhaustion and that pressure to be, serene. What's going on there?
Right, mom rage. Postpartum Support International describes it as these episodes of uncontrollable anger, often followed by really intense guilt or shame. It often stems from feeling powerless or like your needs are constantly ignored or just injustice. Think about it, you're exhausted, maybe feeling unsupported, and then something small like the chores aren't shared fairly can just set you off. It's tapping into something deeper.
That really changes how you see it, not as a personal flaw, but maybe a signal that something's not sustainable. So what can someone do in the moment or to prevent it?
Identifying your triggers is a big first step. What situations usually set it off? Keeping track can help. Then, coping strategies. Things like deep breathing, tensing and releasing muscles, somatic stuff, or cognitive things like practicing self-compassion instead of beating yourself up. And definitely talk to your partner about sharing the load more fairly. That's huge. Therapy, like CBT, can also be really effective. But it also points to bigger issues, We need better support systems, better parental leave, more focus on maternal mental health overall.
Okay, another feeling that catches people off guard. Being touched out. It sounds kind of mild, but it's this feeling of just physical and emotional overload from constant contact.
Yeah, it's a very real thing. Psychology Today talks about it as feeling almost anxious or even repulsed by more physical touch, even from loved ones. It often happens because, society expects moms to provide almost all the physical comfort and holding for a new baby. Your body is constantly on call.
So how do you manage that without feeling like a bad parent? How do you carve out that space?
First, just know it's normal. Feeling this way doesn't mean you love your baby any less. It's super common. Second, talk to your partner. Communicate when you need a break from physical contact. Let them take over the holding or feeding sometimes. Encourage other caregivers, if you have them, to have that contact too. Gives you a breather. You can even start teaching older kids about asking before climbing all over you models consent. Reduces that constant stimulation. And really try, even for just a few minutes a day, to have some time completely to yourself without anyone touching you. Recharge.
It seems like so much comes back to sleep, or the lack of it. We all know tired, but new parent exhaustion is something else entirely. How bad is the impact on mental health, really?
Oh, it's profound. Research from Massachusetts General Hospital actually quantified it. Women with postpartum depression symptoms, they sleep about 80 minutes less per night. And it's not just less sleep, it's worse quality sleep, more waking up. It creates this nasty cycle. Lack of sleep makes depression and anxiety worse. And interestingly, the mom's sleep issues can even affect the baby's sleep. They found infants of moms with depression often sleep poorly too.
Wow, a feedback loop. So what's the practical advice for surviving this? I mean, newborns have to wake up, right?
Right, you can't avoid it completely. But prioritize sleep when you can. That old advice, sleep when the baby sleeps. Honestly, do it if possible. Even short naps help. Try to create a good sleep space for yourself. Dark, cool, maybe limit phone use right before trying to rest. And if you have a partner or support, share the night duties. Split feeds, alternate who gets up. Even a few hours of unbroken sleep can be a lifesaver. But if the fatigue is just crushing, or your mood is really low, or you just can't sleep even when you have the chance, talk to your doctor. Sometimes treating underlying issues helps sleep immensely.
Okay, let's shift a bit to physical recovery after birth. This is definitely an area where the unspoken truths really hit home, like vaginal and perineal healing. People often don't realize how long that can actually take.
Exactly. The timelines can be surprising. Mayo Clinic gives some good benchmarks. A small first-degree tear might heal in a few weeks. Second degree, maybe 3 to 4 weeks. But the more extensive ones, third or fourth degree tears that involve the muscles around the anus, those can easily take 4 to 6 weeks, sometimes much longer. Maybe even needing physical therapy. It's not just a little soreness. And things like ice packs, sitz baths, those peri bottles for rinsing, stool softeners, they're not just nice-to-haves, they're pretty essential for comfort and healing.
So what's the absolute must-do advice for helping that healing process along?
Hygiene is key. Using the peri bottle after you pee, changing pads often, gently patting dry, avoid tampons or sex until your doctor gives the okay. Manage the pain, use whatever your doctor recommended, take stool softeners so you don't strain. Ice packs are great, especially early on. And really important, know the warning signs. If you have severe pain, a fever, a bad smell down there, or any trouble controlling gas or stool, call your doctor right away. That could be infection or a complication.
And then there's C-section recovery. It's easy to forget it's major surgery. The healing is totally different.
Absolutely. ACOG, the obstetricians group, points out that you can expect things like cramping, some bleeding, and definitely incision pain or numbness for maybe 4 to 6 weeks. The key thing to remember is your whole core has been through a lot. It's not just the skin healing. So precautions matter. Don't put anything in the vagina until you're cleared. And watch for warning signs. Fever, heavy bleeding, bad pain in your legs, any weird discharge from the incision, call your doctor.
What does that recovery look like day to day? What can you actually do?
For the first few weeks, really limit lifting, nothing heavier than the baby. Brace your stomach if you need to cough or laugh, it helps. Keep the incision clean and dry, just follow whatever your surgeon told you. And start moving gently. Short walks are actually really good for circulation, help prevent clots. But hold off on any intense exercise until you get the green light, usually around that 6-week mark.
Pelvic floor health. Okay, this is another huge one nobody seems to talk about much beforehand. Weakness, incontinence, even prolapse.
Yeah.
It's way more common than people think.
Oh, incredibly common. Pregnancy and birth put enormous strain on those muscles. The Royal College of Obstetricians and Gynecologists actually recommends starting pelvic floor exercises, Kegels, basically right after birth. Mayo Clinic suggests doing them regularly. Squeeze, hold for maybe 10 seconds, relax, do sets of 10 several times a day. It can genuinely help reduce leakage. The surprising thing is how many women just sort of accept incontinence as, what happens after babies and don't realize exercises can make a real difference.
So what's the bottom line for strengthening that area? Is it just Kegels?
Kegels are the foundation, definitely. Make sure you're doing them right, just tightening those pelvic muscles, not your abs or bum. If things don't improve or if you have significant issues, Seeing a pelvic floor physical therapist is a really good idea. They can get personalized guidance. And simple things help too. Stay hydrated, eat fiber to avoid constipation, don't hold your pee for ages. Less strain on the pelvic floor overall.
And the physical changes don't just stop after a few weeks, do they?
Yeah.
There's ongoing stuff, bleeding, sweating, hair loss that can go on for months and really surprise people.
Totally. The Cleveland Clinic talks about how the uterus shrinking back down involution causes cramps, and that postpartum bleeding, lochia, which can last up to 6 weeks, changing color over time. But then there's other stuff too. Breast engorgement as milk comes in, those lovely night sweats where you wake up drenched, constipation, hemorrhoids, swelling in your hands and feet, even hair loss that might not kick in until a few months later. It's a whole process. Postpartum recovery actually has phases: acute, subacute, delayed. Full recovery can genuinely take 6 months or more. And sometimes later issues pop up, like pain with sex or uterine prolapse.
Right. So given it's such a long haul, what's the key mindset or advice?
Patience. Seriously, your body did an amazing thing and it needs time. Don't expect to bounce back in 6 weeks. That's often just the initial healing phase. Manage the symptoms practically. Nursing pads for leaks, loose PJs for sweats. Keep taking those prenatal vitamins, good for hair regrowth too. And again, know the red flags. Really heavy bleeding, like soaking a pad in an hour. Big clots, fever. Those need a call to your provider, pronto.
Okay, shifting to baby care. Because yeah, they don't arrive with instructions. Breastfeeding is often pushed as the ideal, but lots of moms hit unexpected bumps, soreness, engorgement, worries about supply.
Yeah, it can be tough. Medline Plus points out that nipple soreness often comes down to a bad latch or positioning. Getting help with that early is key. A little expressed milk or safe creams can soothe. Engorgement when your breasts get super full and hard can be managed with massage, warm compresses before feeding, cool compresses after, and feeding frequently. A big misconception is thinking difficulties mean failure, and worries about low supply are super common, but often it's about perception versus reality or temporary dips. Support is crucial here.
So if someone's struggling, what's the most important first move?
Talk to a lactation consultant, like right away. They can check the latch baby needs a deep latch, not just sucking on the nipple and positioning. That solves a lot of pain issues. To manage engorgement and maintain supply, feed or pump often every couple hours in the beginning. Keep an eye on wet diapers, usually 6 or more a day after the first week is a good sign baby's getting enough. Stay hydrated yourself, eat well, and don't suffer through pain. Persistent pain, cracked nipples, signs of infection like mastitis. Get help.
Then there's the crying. Well, the crying. It's how they communicate, but trying to figure out what they're saying when you're sleep deprived is a challenge.
It really is. Sick Kids Hospital actually mentions that crying tends to peak around 6 to 8 weeks old. Some babies might cry up to 5 hours a day then. It feels endless. But the interesting thing is, responding quickly actually helps build trust and, over time, helps you learn the different cries. Hunger cries often start low and build. Pain cries are usually sudden and high-pitched. Fussiness is more intermittent. You start to pick up on the patterns.
Okay, so what's the basic crying troubleshooting process?
Yeah, respond. Don't worry about spoiling them. Meeting their needs builds security. Run through the checklist. Hungry. Need burping. Wet or dirty diaper. Too hot, too cold, tired, overstimulated. Check for illness too. If the cry is unusually high-pitched or weak or constant, especially with a fever or lethargy, definitely get them checked out by a doctor.
Sleep training. Okay, this one's loaded with opinions and myths. Let's clarify.
Yeah.
It's about teaching independent sleep skills, right?
Yeah.
Not necessarily forcing them to sleep all night immediately.
Exactly. It's about helping them learn to fall asleep on their own or fall back asleep when they naturally wake up between sleep cycles. And research, like studies cited by UChicago Medicine and the AAP, is quite reassuring. It shows sleep training can actually lower babies' stress levels, cortisol, once they learn the skill. And importantly, it doesn't seem to harm attachment or cause long-term behavioral issues. It's teaching a skill, like any other.
So what's the practical advice if parents are considering it?
First, talk to your pediatrician about timing. Often it's considered around 4 months, maybe 14 pounds, when night feedings might not be physiologically necessary anymore. Choose a method you feel comfortable with. There's cry it out, Ferber with timed checks, gentler methods like the chair method. The key, honestly, is consistency. Whichever method you choose, sticking with it is what makes it work. Inconsistency is confusing for the baby. And always, regardless of sleep training, follow safe sleep rules. Back to sleep. Firm, flat surface, no loose bedding, cool room. Reducing SIDS risk is paramount.
All right, let's get down to the nitty-gritty. Diapers, cleaning, laundry, the sheer volume can be shocking.
Oh, it's relentless. Newborns can easily go through 8 to 10 diapers a day. So yeah, preventing diaper rash is a constant job. Clean well, dry thoroughly, use a barrier cream, and bottle hygiene. You need to be meticulous. The American Cleaning Institute stresses washing hands, taking bottles completely apart, washing in hot soapy water, ideally in a separate basin, not the sink, rinsing well, and air drying. For babies under 2 months or with health issues, sanitizing daily, boiling bleach solutions, steam is often recommended. It sounds like a lot, but it's crucial.
And the laundry pile, I hear it achieves mythical status.
It truly does. Pro tip, treat stains, especially poop stains, immediately with cold water before they set. If you're doing cloth diapers, that's a whole separate routine. Cold rinse, hot wash, specific detergents usually, air dry covers. Setting up a good diaper changing station, maybe one upstairs and one downstairs, with everything right there. Saves you so much time and hassle.
Formula prep is another area where precision really matters for safety and nutrition. It's not just scoop and mix.
Absolutely not. The CDC guidelines are clear. Wash your hands thoroughly first. Use clean bottles. Use safe water. A critical point. Always measure the water first, then add the powder. Getting the ratio wrong can dilute nutrients or be too concentrated for the baby's system. Prepared formula is good for 2 hours at room temp or 24 hours in the fridge, and anything left over in the bottle after a feed, toss it. Bacteria grows fast. For young infants, preemies, or babies with immune issues, using boiled water that's cooled for about 5 minutes before mixing is recommended to kill potential Chronobacter bacteria in the powder.
So the non-negotiables for safe formula feeding.
Follow the package instructions exactly for the water to powder ratio. Warm bottles safely, no microwaves. Use warm water instead. Test on your wrist. Store correctly, discard leftovers immediately after feeding. Date the formula container when you open it and use it within a month. Simple rules, but vital.
Okay, let's quickly touch on pregnancy do's and don'ts. Starting with diet, that list of forbidden foods can feel really long and sometimes confusing. What's the real deal?
It's mostly about avoiding potential infections or toxins. Mayo Clinic outlines the big ones. High mercury fish like swordfish or big eye tuna, bad for babies' brain development. Stick to safer fish like salmon or sardines. Raw or undercooked meat, poultry, eggs, and seafood risk of things like salmonella or listeria. Deli meats and hot dogs need to be steaming hot to kill listeria. Unpasteurized milk, cheeses like brie, feta, unless clearly labeled pasteurized. And juices, again, listeria risk. Also, wash all fruits and veggies really well and skip raw sprouts due to bacteria risk.
Right, and what about caffeine, alcohol, herbs?
Caffeine limit is generally under 200 milligrams a day, which is about 1 standard cup of coffee. Alcohol. Complete avoidance is the safest bet. No amount has been proven safe during pregnancy. Herbal teas and supplements are tricky. Many haven't been studied in pregnancy, so you absolutely need to check with your doctor before taking anything, even if it seems natural.
And lifestyle. Exercise is good, right? But are there things you really shouldn't do?
Yes, exercise is great. ACOG recommends about 150 minutes of moderate activity a week. Good for back pain, mood, reducing gestational diabetes risk. But yeah, some things are off limits. Contact sports, obviously. Activities with a high risk of falling, like skiing or horseback riding, hot yoga or hot Pilates because of overheating, scuba diving, and exercising at super high altitudes. Basically, avoid trauma to the abdomen and avoid getting overheated.
So what's the key advice for staying active safely?
Avoid hot tubs and saunas too. Raising your core body temp too high, especially early on, is linked to potential birth defects. Good choices are things like brisk walking, swimming, prenatal yoga in a regular temp room, stationary biking, drink lots of water, don't exercise outside when it's super hot and humid, and listen to your body. If you feel any warning signs, bleeding, dizziness, chest pain, bad headache, contractions, stop immediately and call your doctor or midwife.
Finally, let's get into relationships and social stuff, because having a baby puts a massive, often unexpected strain on partnerships. Communication can break down, chores become battlegrounds, intimacy changes.
It's a huge transition. Research shows a definite link between postpartum depression and marital problems affecting up to 20% of moms. Interestingly, feeling satisfied in the relationship can actually buffer against PPD symptoms, common flashpoints. Feeling neglected, partners withdrawing, anger getting misdirected, and yes, disagreements over chores and baby care are a major source of conflict, studies show. Plus, about 10% of dads experience PPD too, which adds another layer. Financial stress is also huge. Over half of women report significant financial worries related to having a baby. And intimacy, it often takes a hit. Pain after birth, body image changes, sheer exhaustion all play a role.
That paints a tough picture. So what can couples proactively do to navigate this without drifting apart?
Communication is everything. Really talk to each other. Schedule check-ins, use I feel statements, try to understand each other's perspective, share the load. Like, really share it. Feeding, diapers, chores, night wake-ups. Feeling like a team makes a world of difference. Consider couples counseling if you're really struggling to communicate. It can provide tools. Protect time together, even if it's just 15 minutes talking after the baby's asleep. Reconnect. Be patient with intimacy returning. Talk about expectations. Find other ways to be close. And tackle financial stress head-on. Budget. Look into support programs. Plan parental leave finances beforehand if possible.
Then there's the pressure from family and friends, visitors, advice, wanted or not. Setting boundaries feels crucial for recovery and bonding, but it can be so awkward.
It can be really hard. But places like Helloa, that parenting site, stress creating a sanctuary those first few days or weeks. Quiet, skin to skin, it's important for baby's development and your own stress levels. The interesting thing is, setting clear expectations up front about visits often causes less tension than trying to manage people dropping by whenever. It also reduces infection risk for the baby.
Okay, give us some practical tips. How do you actually set those boundaries without offending everyone?
Maybe send out a group text or email after the baby arrives. Say something like, "We're thrilled baby is here. We're settling in and need some quiet time. We'll let you know when we're ready for short visits. Please text before coming, wash hands well, and no kissing the baby for now." Most people understand. Keep initial visits short. Don't feel like you have to host. It's okay to ask visitors to help. Could you bring dinner? Or would you mind folding that laundry? And decide your own rules about sharing photos on social media. Ask others not to post pictures without checking with you first. Protect your privacy.
Last point, isolation. It's so common for new parents to feel lonely, even if they're surrounded by people, especially if support doesn't quite match expectations.
It's a huge factor, often linked to PPD. Feeling unsupported, feeling like communication with your partner isn't working, it breeds isolation. But the good news is that practical support really helps. Friends or family bringing meals, helping with older kids, doing chores that tangible help significantly cut stress and boost confidence.
So how can new parents actively fight that isolation and build the support they need?
Don't be afraid to ask for specific help. People often want to help but don't know how. Tell them what you need. Could you pick up groceries? Could you watch the baby while I shower? Find your tribe. Join local new parent groups, online forums, look into postpartum doulas. Connecting with others in the same boat makes a massive difference. Keep talking to your partner. Identify when each of you needs a break or more support. Acknowledge it's hard for both of you. And if those feelings of loneliness or being overwhelmed just won't lift, please reach out for professional help. Therapy, support groups, even teletherapy options are available.
Wow, okay, that was a really comprehensive deep dive into some tough but essential truths. Pregnancy in that first year, yeah, it's messy, it's amazing, and it's just profoundly real. The big takeaway seems to be asking for help, setting boundaries, going at your own pace. Those aren't signs of weakness, they're signs of incredible strength.
Exactly. And for everyone listening who's going through this or about to, your resilience is incredible. What you're doing, the love you're giving it is absolutely enough. You are enough. And please remember, you are so not alone in feeling any of this. It's not about being perfect. It's about finding your way, connecting, and growing.
That's a perfect note to end on. Thanks for joining us for this deep dive. Please remember to like and subscribe or follow My Mind MashUps for more conversations like this. You can find us on Amazon Music, Audible, Facebook, Pocket Casts, Spotify, and YouTube. Until next time, stay curious.